We're now back for final thoughts on the issue of Social Security and Medicare with Barbara Kennelly, the President and CEO of the National Committee to Preserve Social Security and Medicare. Ms. Kennelly, again, of course, our apologies for cutting in on your final answer, but we had to go to Secretary Geithner. Sure. You were listening in. I was wondering if we might get your thoughts.
Oh, I thought his statement was excellent. I am thrilled that the President keeps saying he's going to do health care reform, and then after he does health care reform, he's going to look at the long-term problem of the out years and Social Security. And let me tell you something. My 4 million members and supporters want to work with him. We don't only care about Social Security for ourselves. We care about it for our children and our grandchildren. I thought the statement was excellent. I think the attitude is excellent. And I will once again say they did say that Social Security can pay full benefits for the next 30 years.
What will your organization be pushing for when this debate is finally joined?
Well, what we're really worried about is when you're not talking, you hear about entitlement reform. And entitlement reform, to a lot of people, means cuts. And what I don't want to see is, you know, Social Security benefits are very moderate, very moderate. It's about $13,500 a year. And so when you talk about cutting benefits, I get very nervous. You talk about raising the age, you know, we have to look at that, but right now it's up to 67. And I'll tell you, a lot of people 65, 66, and 67, there's no jobs out there for them. So there's a lot of work to be done. But I thought the Secretary of the Treasury's remarks were excellent, and I look forward to working with this administration.
How do you counter those who've been calling for the privatization of Social Security?
I gave my life to it for about 5 years. Aren't we glad now that we didn't put some of the Social Security trust funds money into Wall Street? Already people's 401ks are down, the worth of their house is down. I'll tell you something, privatization is over. That thought we don't even get. It's the looking at the entitlement reform, and what some people really want to do is get rid of the entitlements. So there's always a fight. Ever since Franklin Roosevelt, there have been enemies of Social Security, and you're going to hear on your program they're going to look at what the surplus is for just the year surplus, not the long-term surplus.
Right.
And that has gone down because of the recession. People aren't working.
Ms. Kennelly, we have about a minute left. I was wondering what kind of benefits for Social Security and Medicare are you and your organization willing to give up to help reform the two systems?
I was there in 1983. I was on the Ways and Means Committee during the reform, and it was a combination of many, many changes in the Social Security system. The Social Security system is very complicated. Everybody's Social Security is different. It's computed differently. And so, yeah, you have to look at what's coming in and what's going out. They have what's called a bend point, so where you do certain amounts to become benefits. There are ways you can do it. Are they going to have to raise the age? I don't know. Maybe, maybe not. But there's all sorts of things that can happen. It goes into a package, and that package can be passed. What I don't want to see is just benefit cuts and raise the age and not looking at the whole program.
Barbara Kennelly, President and CEO of the National Committee to Preserve Social Security and Medicare, joining us from Washington. Thanks.